Hi One West, I hope that you and your family are doing well. For those who don't know me, I'm Captain Luo and I'm the Assistant Training Officer at One West Montreal Squadron. In my civilian life, I work as a resident physician at the McGill University Health Center in the Department of Orthopedic Surgery. It is an understatement to say that our lives have changed due to the coronavirus outbreak. It has drastically changed our daily routines, going from schools being closed or moved onto online teaching. The streets are mostly empty as people are practicing social distancing, and even cadets have moved our Wednesday training nights onto YouTube. Personally, I have also seen many changes in the hospitals I work in, and I'm here to share with you my perspective as a doctor working during the COVID pandemic. Thank you for those who have sent in your questions. I will try to go through them one by one during this video. As a disclaimer, these are only my personal opinion and they're based on the information that is available as of today, which is April 29th, 2020. The situation is constantly evolving and I would urge you to stay up to date with the latest government recommendations. So starting off with the first question by Flight Surgeon Chan, who asks, how many years have you been working as a doctor? So I graduated from med school in the summer 2019 and started working as a resident physician in July 2019. It is a 5-year residency program and I'll be training to become an orthopedic surgeon. In terms of my recent experiences, I have been deployed to the COVID unit at the Jewish General Hospital, and a lot of my experiences I'll discuss later will be based on this redeployment experience. So the cadet Calavitinos asks, how long does your work shift last? When I was working at the Jewish General Hospital on the COVID ward, each shift lasts around 12 hours. So you're scheduled to be there, for example, from 8 a.m. to 8 p.m. or from 8 p.m. to 8 a.m. And with each shift changes, they are what we call handovers or sign-outs. So basically information about the patients that are currently admitted, and these information will be passed on to the next team that's going to be coming on. So I would think all in all, with that taken into account, I would say my work days are usually around 13 to 14 hours long. So Flight Surgeon Wong asks, how do you feel about sacrificing your life for the others? So I think this is a great question. And interestingly, when I was reassigned to work on the COVID unit, they use a lot of terms very close to the military in terms of, you are being redeployed. And each floor is a battleground, and that we were having these meetings, these multidisciplinary meetings, and these would be called the war meetings. So I think it's quite interesting, the analogy that we can make, that our current situation is similar to us going to war against an invisible enemy. Actually, many people that work every day in essential services who are risking their lives to make everything run. So the way that I think about it is that I'm there to do my job and to use my skill and knowledge to be able to help others. For the hospital to be able to run, it really depends on a whole network of allied health professionals. So those not only include doctors, but also the nurses, the préposés, the cleaning personnel, the cooks, the security guard. So all of these people are all working and putting themselves at risk of catching the virus. So yes, we might be a bit more at risk of catching the virus because we're working in close proximity with patients, but I think at the end of the day, if we're able to help them and get for them to get better. I think it's a very rewarding feeling. So Flight Surgeon Wong asks, what is it like to not be able to help patients as there's no cure yet? So I think this is an excellent question. In medicine, we often have the impression that there's always a treatment, a pill, a surgery to help correct or help the patient get better. But in this, because of COVID, which is also called the novel coronavirus, which means that it is brand new and there's still so much that we don't know about this virus yet, and that includes what is the best way of treating it. So there are some evidence that indicate that azithromycin and hydroxychloroquine may help in decreasing the viral load and perhaps helping patients getting better, but there's still a lot of research that needs to be done to kind of make sure that these medications are effective. The main treatment that when patient comes into a hospital consists of just making sure that they're breathing well, that if they're spiking a fever or they have another infection that's on top of the virus, that we will be giving antibiotics to treat that. Unfortunately, more and more of our patients are coming from senior homes or CHSLDs, and they tend to be the elderly who already have a lot of medical issues, and unfortunately some of them will end up passing away. And I'd say even though we don't have the ability to cure them, just helping them through the process of passing away by making sure that they pass away in dignity and without any suffering is also a valuable goal to strive for. So Flight Surgeon Wong asked, what has kept you strong through this whole pandemic? So it is, I do have to acknowledge that this is a very challenging time, mostly emotionally, because we're facing with a lot of uncertainty, and patients and their family are turning to you to give them some clarity and some answer, and sometimes there's just no clear answer that we're able to give them. The other thing that's very hard is that patients are hospitalized alone because hospitals have policies now to minimize visitors, which makes it very hard for patients and their family because they're not able to visit and see each other. So what has kept me strong through this pandemic? I would say definitely friends and colleagues checking in and asking how I'm holding up, whether it's via text, via phone call, or FaceTime or Zoom calls. So these check-ins are greatly appreciated, and it helps me to stay connected. I think technology is really wonderful these days to stay connected despite our physical distancing. The other thing that keeps me going is to think that, well, there's going to be an end to this, and we will be able to overcome this hurdle, and hopefully gradually getting back to a sense of normal. It might not be exactly the life that we had before, but I think we will definitely not be staying in lockdowns indefinitely. Okay, Calvertinos asks, what does your family say about your profession? So I think if you were to ask this question to my parents, it would be a mix of pride and also anxiety. For sure, they are very proud to say to others that their daughter is out there in the front lines helping to fight COVID. But they're also very worried that I may be contracting the disease, that I might not be adequately protected, that I might get tired and fatigued from working long hours at the hospital. And so my parents have been trying to keep their distances, as I'm a healthcare worker, but we're still in contact on a daily basis. So Flight Surgeon Chen asked, is there a lack of PPE? So PPE stands for personal protective equipment, and these include anything from masks to head covers to face shield to isolation gowns or jackets that you would use to cover yourself if you were to enter a room with a patient who is either confirmed or suspected of having the coronavirus. And the answer for the lack of PPE, I would say that it is a constant fear, because we get newsletters on a rather daily basis that tells us contingency plans if ever there's a lack. So I think it's definitely on everyone's mind that the supply is not as consistent, and that sometimes there may come a time that we might be lacking. So is there a lack of PPE? I think it is a constant worry because of the unstable supply that we have, and because many countries are now dealing with coronavirus outbreaks, so everyone is there's a very large demand for personal protective equipment. An anonymous cadet asked, are you scared of getting the virus? Yes, I think anyone should be scared of getting this virus, because from the experience I have seen so far, it really does not spare anyone. You could be 20, 30, 40 in really good health and still have very bad reaction to this virus. So I don't think that this is a virus that should be taken lightly, and you should really do everything possible to try to prevent catching this virus. So this ties in with the next question by Cadet Turner, who asked, what happens if a doctor gets the virus? Healthcare workers are definitely at higher risk of catching the virus, because we work in close proximity with the patients, and we also work with many patients, so our exposure, it's higher than the general population. So if a doctor or any healthcare worker exhibits symptoms of the virus, then they will be swabbed for COVID. So if they test positive and they have mild symptoms, then they would be asked to stay at home and be quarantined until they no longer have the symptoms, and sometimes some workplaces ask that they test negative for the virus before being able to come back to work. If they develop more severe symptoms and, for example, needs oxygen, then they will likely need hospital support and need to be hospitalized. So Flight Surgeon Chen asks, are masks effective? So this is an excellent question, and I think it depends on the type of mask and how you use it. At first, there's a difference between what we call a surgical mask and an N95. I think a lot of people, there has been a lot of hype around the N95 mask, and I'll try to explain what the mask actually is intended for. So a surgical mask, it looks like this, and is worn usually for people who have symptoms. So if you are coughing, you're sneezing, you are quote unquote releasing viral particles outside, then by putting on a surgical mask, you're preventing the spread of the virus to other people. There are now more signs of community spread, which means that people in the community, without necessarily knowing, might actually have the virus, and some of them may be asymptomatic, so they may not exhibit any symptom whatsoever. So because of that, the government has updated their recommendations and now recommends that when you're going to public spaces like in public transit, maybe in grocery stores, in pharmacies, that you wear some sort of face covering as well. Then we have the N95. So I have here an N95. It looks like this. It goes and covers a lot of your face. So these masks are called N95 masks because they're supposed to be able to filter out 95% of particles, and they're not solely used for medical purposes. So people in the industries who work with chemicals or lots of particles have also been wearing N95 masks in the past. So the hype with N95 is that it's able to filter out 95% of the particles, and the virus is not large enough to be able to pass through the mask. However, I want to stress the fact that an N95 should be reserved for healthcare workers because one, we receive particular training to wear this mask, and two, we actually have a fit test. So the whole purpose of this mask in doing its job of filtering out is it has to have a very good seal around so that all the air that you're breathing in filters through the mask. The recommendation for N95 is that these should be really reserved for the healthcare workers who are at the front line, who are exposed at large volume of the virus, and especially for those who are doing what we call aerosolizing procedures, which means that, for example, if they're suctioning, if they're putting a tube down to someone to help someone breathe better, then they're generating a lot of aerosol, a lot of viral particles that can be floating into the air as a result. So they really need the protection of the N95. And if everyone starts buying any N95, these resources will not be getting to the hands of the healthcare workers that needs it the most. Now, with the recommendation of wearing face coverings in public, there has been a lot of homemade videos and DIY videos online that could teach you on how to make your own face covering, and I think these are better than not wearing anything in public. I would just like to caution everyone about the risk of contracting the I would just like to caution everyone about touching your face, because one of the methods that the virus gets into your body is when you touch your mucosal surfaces. So basically your nose, your mouth, your eyes. So by wearing a mask and, you know, potentially adjusting it, you might put yourself at a higher risk of maybe catching the virus. So please make sure to practice good hand hygiene and avoid touching your faces. An anonymous cadet asks, if you develop symptoms, do you go directly to the hospital or do you isolate yourself at home? So if you are developing symptoms, fever, cough, shortness of breath or difficulty breathing, severe diarrhea or vomiting, unusual fatigue or loss of sense of smell without a stuffy nose, you should definitely try to call one of the numbers. Call 514-644-4545 in Montreal, or 1-800 or 1-877-644-4545. You may also visit one of the designated testing clinics. So if you have any difficulty breathing, you should be visiting an emergency room as soon as possible. So Cadet Shin Se-John asks, is there any other way to learn if we have the virus or not instead of going to the hospital and waiting for a long time? I would first urge you to not go to the hospital unless you absolutely need to. So instead of going to the hospital, please call the phone numbers or visit one of the testing clinics that are designated for that. Thank you to everyone who have sent in questions, and I hope that this video was insightful. Thank you to all of you who are practicing social distancing and avoiding all non-essential travels and gatherings. In doing so, you guys are saving lives and making a difference in preventing the hospital to be overwhelmed with COVID cases. In these uncertain times, I would urge you to keep your mind and body healthy. I think since we all have a bit more times in our hands right now, I think it's a great time to explore your interests, to stay curious. So one great example of that is these 3D printed ear gears, which can help alleviate pressure from constantly wearing surgical masks. I think there's definitely room to innovate and to think about different ways that you can help during this pandemic. Remember to stay in touch with your family and your friends, because physical distancing can be very hard on the morale, and we have now so many different ways to connect with each other. So I'll end this video by wishing you all to stay safe, to stay positive, and that we will get through this together. Thank you.